We are very much opposed to having somebody like Anthony Fauci, 79-year-old career bureaucrat, this one-man dictator who is saying this is the standard of care. The standard of care is supposed to be what competent physicians think is reasonable.
Doctors with the Association of American Physicians and Surgeons say there's no reason the nation should be locked down when safe and affordable medicine like hydroxychloroquine could be available to all Americans. One America's Pearson reports.
As President Trump battles to reopen our nation and get Americans back to work, radical left-wing leaders across the country are fighting to keep residents locked in their homes. This comes despite repeated assurances from doctors that not only is there a cure for the coronavirus, but that it's also cheap, safe, and widely available. One America News spoke with Dr. Jane Orient, the executive director of the Association of American Physicians and Surgeons, the AAPS, representing over 5,000 doctors across the United States. Dr. Orient says hydroxychloroquine is a great method for tackling the coronavirus and that the government needs to stop interfering with physicians' ability to treat their patients.
We are very much opposed to having somebody like Anthony Fauci, 79-year-old career bureaucrat, this one-man dictator who is saying this is the standard of care. The standard of care is supposed to be what competent physicians think is reasonable.
Doctors with the AAPS recently announced hydroxychloroquine has a better than 90% chance of curing patients suffering from the coronavirus. Based on more than 2,300 patients who received treatment, nearly all of them either got better or didn't get sick at all after taking the medicine.
Hydroxychloroquine has been shown to be effective. I think if more doctors were allowed to prescribe this medicine, I think the outbreak would see a dramatic downward turn. I think all Americans should have access to hydroxychloroquine. Why should Americans not have the ability to get a medication that their physician prescribes?
However, Dr. Orient says that in many states, governors and pharmacy boards are still preventing doctors from prescribing the medicine, which she says is only holding back our nation's recovery.
Saying we've got to keep the country locked down and destroy our economy until there's a vaccine. But in the meantime, people are dying, and I do not understand why anybody would discourage doctors from, based on their own discretion, their own judgment, and the patient's informed consent, prescribe this drug.
Worse still, as Dr. Orient explains, hospitals are being paid more to blame coronavirus for as many deaths as they can, even if the patients died from something else, like heart disease. And any doctors who don't go along with it could not only find themselves unemployed, but unable to get work again. Meanwhile, despite President Trump's efforts to reopen the nation, radical leftist governors like Gavin Newsom and Gretchen Whitmer have fought to keep their states closed as long as possible, ignoring the protests of Americans whose lives are being destroyed by the lockdown.
We cannot wait to reopen the country for a vaccine or cure. The country has already had staggering economic losses, and some of these will be irreversible. People have lost their livelihoods, they've lost their businesses, they've lost their savings, they're desperate. We have got to get the country back to work.
Even after decades of research, there are still no vaccines or cures for diseases like HIV, AIDS, malaria, or even the common cold. And if we wait to find one for the coronavirus, there won't be anything of the American economy left to come back to. Pearson Sharp, One America News.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube. And call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.